Namaste Vidya, Hamisha Khush Raho Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine at Faculty of Homeopathic Science in JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about anemia and its classification. Anemia is the most common disorders for which the females are coming to you. So we must know what is anemia and how will we classify anemia. Let's start with hematology first, the introduction part. Hematology is the study of blood in health and disease. It includes the problems with the red blood cells, the white blood cells, the platelets, the blood vessels, the bone marrows, the lymph nodes, the spleen, and the proteins involved in bleeding and clotting, that is hemostasis and thrombosis. Now, the common hematological disorders. The common hematological disorders consist of anemias with hemoglobinopathies, leukemias, lymphomas, and coagulation diseases. So, these all diseases we are going to discuss in hematology. What? Anemias, hemoglobinopathies, leukemias, lymphomas, and coagulation disorders. This is the hemopoietic system, how the formation of different cells of blood system like the megakaryocytes, the erythrocytes, the leukocytes and the lymphocytes are formed. These all things we have already discussed or learned in your first year physiology, so I'm not going to discuss them again, but this is just for the recall process that how the hemopoiesis takes place in the body. So let's move ahead, and I believe that you will learn it from your physiology and also from the practice of medicine book. Now let's learn about the various hemopoiesis sites in the body where the formation of blood cells takes place. The most important and the most common is the bone marrow. In normal childhood and adult life, the marrow is the only source of new blood cell formation. The sites of hemopoiesis we will be discussing here at the different ages. Like in fetus, the site of hemopoiesis from the age group of 0 to 2 months is the yolk sac. From 2 to 7 months, it is liver and spleen. From 5 to 9 months, it is the bone marrow. In infants, the bone marrow, practically all bones, leads to hemopoiesis. In adults, the vertebrae, the ribs, the sternum, the skull, the sacrum, and the pelvis, the hemopoiesis takes place. And also the proximal ends of femur. Hematology is a branch of medicine that involves the study and the treatment of the blood. Now let's start with anemia. Anemia is defined as the reduction of hemoglobin levels below the normal values for different ages and sex groups. Anemia is a decrease in total amount of red blood cells, that is RBCs or the hemoglobin in the blood, or lowered ability of the blood to carry oxygen. Anemia is defined as the reduction of hemoglobin levels below the normal values for different age and sex groups. It is the decrease in total amount of red blood cells, RBCs or hemoglobin in the blood, or a lowered ability of the blood to carry the oxygen. Anemia can be classified on different ways. On the basis of cause, it can be classified on the decreased production of red blood cells, increased destruction of the red blood cells, and acute blood loss. So 3 conditions: decreased production, increased destruction, and acute blood loss. The classification you can see in this picture. On the basis of cause, we have 3 types: blood loss, inadequate production of normal blood cells, and excessive destruction of normal blood cells. On the basis of morphology, the anemia can be normocytic, microcytic, or macrocytic. Normocytic, microcytic, or macrocytic. The morphological classification of anemia consists of three parts: microcytic hypochromic, normocytic normochromic, and macrocytic normochromic. All these things we have already discussed in your first year and second year in physiology and pathology. Now, workup. The morphological classification is dependent or based on the MCV, that is mean corpuscular volume of the RBC. We have three types: microcytic, normocytic, and macrocytic. The microcytic, when the RBC size is lesser than normal, normocytic when it is normal, and macrocytic when the size of RBC is greater than the normal cell. Now we are going to see the conditions in which we see three of them. Microcytic anemia is seen in case of iron deficiency anemia, chronic infections, thalassemias, hemoglobinopathies, and sideroblastic anemias. The normocytic is seen in case of chronic diseases like the chronic kidney disease, early iron deficiency anemia, hemoglobinopathies, primary marrow disorders, combined deficiencies, and increased destruction of the RBCs. The macrocytic anemia is seen in case of megaloblastic anemias, with liver disease or alcohol, hemoglobinopathies, metabolic disorders, marrow disorders, and increased destruction of the cells. The functional classification can be done in the following way. Number first, the marrow production defect, that is hypoproliferation of the marrow, that is marrow damage or iron deficiency. The red cell maturation defect, that is seen in case of ineffective erythropoiesis, cytoplasmic defect, iron deficiency, thalassemia, and sideroblastic anemia. Next, we have nuclear defects, that is seen in case of folate deficiency, vitamin B12 deficiency. There is also decreased red cell survival, that is seen in case of blood loss or hemolysis, blood loss, hemoglobinopathy, or membrane abnormality, etc. Now, there are various blood indices about which we should know. Number first is mean corpuscular volume, that is the volume of one particular RBC, that is indicated by MCV. It is calculated by PCV in liter by liter upon RBC count per liter. The normal values of MCV is 85 plus minus 8 fem per liter, with a range of 77 to 93 fem per liters. The second one is MCH, that is mean corpuscular hemoglobin. It is calculated by hemoglobin per liter divided by RBC count per liter. The normal range of MCH is 29.5 plus minus 2.5 picogram, with a range of 27 to 32 picograms. The third one is MCHC, that is mean corpuscular hemoglobin concentration. It is denoted by hemoglobin per deciliter divided by PCV in liter per liter. The normal value is 32.5 plus minus 2.5 gram per liter, or 30 to 35 gram per deciliter. Now, the clinical features of anemia. The non-specific symptoms consist of tiredness, lightheadedness, breathlessness, ankle swelling, development or worsening of the ischemic symptoms, example angina or claudication. I will again repeat these symptoms: non-specific symptoms of tiredness, lightheadedness, breathlessness, ankle swelling, and development or worsening of the ischemic symptoms, example angina or claudication. The non-specific signs consist of mucous membrane that is becoming pellar, tachypnea, raised jugular venous pressure with flow murmurs, ankle edema, postural hypotension, and tachycardia. I will again repeat these non-specific signs, that is mucous membrane pellar, tachypnea, raised jugular venous pressure, flow murmurs, ankle edema, postural hypotension, and tachycardia. So this was all about the classification of anemia and the clinical features in general. In the next lecture, we are going to start with iron deficiency anemia. This session is powered by digital version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. We will be meeting in the next lecture tomorrow. Thank you.